So shoulder pain is very common, and there's clearly a multitude of causes for the shoulder pain. I think we can break it down into sort of traumatic or overuse type injuries. Traumatic injuries in an older person, or even younger person for that matter, might be due to a motor vehicle accident or a fall onto the shoulder, and that's clearly going to cause pain. A lot of young athletes will land on their shoulder and dislocate the shoulder, where the ball pops out of the socket. That's a very common cause of shoulder pain, and that happens traumatically, and it's something that we treat a lot of here at Aspetar. The other sort of big group of shoulder injuries really relate to overuse, and in kind of patients in their 40s, 50s, and 60s. That's just from years of being active, playing sports, working out, just using your arms in an everyday fashion can often lead to things like rotator cuff tears, bursitis, inflammation in the shoulder that causes pain. Younger athletes typically don't get rotator cuff tears, but they also can get shoulder pain from overuse. And in that group, one of the most common things that we see are called labral tears. And a little bit of anatomy, but basically the shoulder is a ball in a socket. Around the socket is the labrum, and it really helps keep the shoulder stable. So in athletes like volleyball players, cricketers, swimmers, baseball players, athletes who are repeatedly using their shoulder hundreds, thousands of times a day or a week, sometimes the labrum can get beat up and cause tearing that causes pain. The treatment of shoulder injuries really depends on what caused the pain in the first place. The more traumatic injuries, shoulder fractures due to an accident, or even a dislocation for that matter, depending on the age of the patient, often responds well to surgical treatment to give the athlete or patient the most predictable return to their activity level without sort of future pain. The good news though is that for most patients with shoulder pain, it's going to get better conservatively. And that really involves a combination of physical therapy, anti-inflammatory medications, and even injections ranging from cortisone injections to PRP or platelet-rich plasma. One of the biggest mistakes I see as a doctor who specializes in shoulder and elbow problems are patients or athletes coming in sort of having waited too long to come to the doctor. A lot of times they try to play through pain, they'll push it, and that's dangerous, because you can make injuries worse. Or you could take something that was going to respond well to just some rest and maybe ice or anti-inflammatory medications. You've now made it a more serious injury, and now we're talking about more invasive methods needed to get the shoulder better. So the advice I give patients is really, if you're having pain that's persisting, that's not getting better with your normal period of rest, it's probably worth seeing a doctor. Also, if you're having pain that's out of proportion that you would normally expect during an activity, you shouldn't push through. This is not the no pain, no gain phase. Listen to your body. If something hurts while you're doing it, back off. Shoulder surgery is very common, despite the fact that most athletes and patients will get better with conservative treatment. There's clearly a group based on their pathology or the fact that they're not responding well to conservative treatment that's going to require surgery. And I think one of the best things that we're now able to offer our patients is the fact that most of the stuff I can do in the shoulder is now done arthroscopically. So what previously used to involve big incisions, more anesthesia, longer recovery times, increased risk of blood loss, now we're doing it with a camera and a few poke holes, so it's much more minimally invasive. It makes the recovery easier, less painful, and I think we're actually able to treat a lot of these injuries even more successfully because of the advances in technology. I mentioned that shoulder injuries are very common in overhand athletes, so swimmers, volleyball players, tennis players, any of these athletes that require repetitive motions of their shoulder are going to be at an increased risk for injury. I think one of the keys though is preventing it from becoming serious enough that they're missing time from their sport or it requires more invasive treatment. So with that being said, I think one of the best things that athletes can do, no matter the sport, is really take time off. This applies to all levels, professionals, but also kids in school and college, where they really should have a prescribed time off from the sport to give that body part a chance to rest. So for tennis players, it's a long season because you can play indoors and outdoors. But with that being said, I really recommend to my patients taking 6 or 8 weeks off every year where they don't play tennis. They can do other things, they can play other sports, but it really gives their shoulder a good chance to rest. I think that combined with, having a good stretching and strengthening program to keep your muscles and tendons and ligaments as strong and flexible as possible will also help prevent injury.